Come in.
Hello, how are you? My name is Brandy and I'm going to be your nurse today. The doctor's ordered for me to do a Foley catheter on you. I'm going to sanitize my hands, provide privacy. Okay, and can you verify your name and date of birth for me?
Sarah Jones, July 15th, 1980.
Okay, thank you. And Ms. Jones, have you ever had a Foley catheter before?
Yes, I have.
Okay, so you know that we're just basically going to take a small tube and insert it to your bladder so that it can help drain the urine from your bladder so that you don't have a buildup of urine after surgery when you're not able to get up and go to the restroom.
Okay,
All right, so do you care if I expose you?
that's fine.
All right, and do you have any allergies to latex, iodine, or shellfish?
No, I do not.
Okay, all right, I'm just going to expose you. All right, and if you would raise your knees for me and just let your legs fall to the side and relax. All right, and it looks, have you had a shower this morning?
Yes.
Okay, and so I'm checking for peri-care, and it doesn't look like she needs any right now because she just had a shower. All right, so I'm going to prepare your Foley catheter, okay?
Okay.
All right. And if I did give the patient peri-care, I would go ahead and take my gloves off as soon as I was done with that and sanitize. Okay. So I'm going to pick that away from me first. Which will stay within my 1-inch border. And pick up from here so that I'm not touching the box. Just going to turn it so that it's not touching me. And my gloves to the side. Okay. Stay within the 1-inch borders of this and lay it shiny side down. And this would go up, have them tuck it underneath their buttocks. All right, and so I'm going to go ahead and take my gloves off. And sanitize again. And I think my brake seal will feel there just because my thumb hit the inside of that, so I'll make sure not to do that. I'm not positive, but just in case. And we're not going to be using this, so we're going to put that to the side. I'm going to move this over so that it's not in my 1-inch border. Okay. And then I would take the iodine, open it up, and put it on the cotton balls, if we had any. Then I'm going to take the gel, open it up, and put it in the corner of the box. And I'm going to take this to the side. And I'm going to put the catheter into the gel. And lay it back down in the box. over to the patient. All right, and so I'm just gonna touch you and go ahead and clean you to prepare you for this, okay? You're gonna open, sorry, but this is not, let's see. So we're gonna open up the labia minora, and we're gonna start at the outer minora first, clean it from top to the bottom, go around, do the outside, top to bottom, go around, and then go from top to bottom down the middle, go around. Okay, Miss Jones, I'm gonna go ahead and insert the catheter. You're gonna feel just a little bit of discomfort, but I want you to bear down for me, okay? All right, and so I just saw a flash of urine, so I'm gonna go 1 to 2 inches more in. I'm gonna pinch it off and go ahead and fill the balloon with 10 mLs. Don't do it too fast. Okay, and so it should give it a little tug and it's good. So I'm gonna come here and take off the syringe. Okay. And now I'm going to go ahead and, since we've done all this, you may have urine on your hands. So I'm just gonna go ahead and take my gloves off and sanitize. And take the bag out. And so we're going to leave a little bit of slack in the bag there. I mean, the catheter there. I'm going to have gloves back on, but I've already taken those off. I put my non-sterile gloves back on to do this. And then we're going to hang the bag to the side on a stable part of the bed at the bottom, not on the handrails or anything. And let's see, I've already checked to see if the catheter would not come out before I took the syringe off. So I'm going to attach this to the thigh with a stat lock. I cannot remember the name of it to save my life. So the stat lock would be here. We have some tape or something there?
Yeah.
Here we go. So we have some tape to simulate this. So we would just attach it to the thigh, making sure there was some slack in there so it doesn't pull and the patient accidentally pulls it out. And make sure, like I said, to hang this on a stable part of the bed. And you're going to take a sample within the first 5 minutes out of the bag. And then you're going to make sure you get all of your stuff together and discard appropriately. Okay, and then when it's time to remove the catheter, you're going to come back in with, make sure you have gloves, alcohol, wipes, your syringe, and a chuck to put underneath them, and then something for cleaning also. And I need to go back and say, after I've done all of this, I'm going to make sure I clean do a post-perineal care, because you're going to have gel on them and maybe, urine, that kind of stuff, betadine or iodine. But then when you come back in to remove, you're going to make sure you do your hand hygiene, don your gloves, and we'll just use this here as a chuck, maybe, as an example. Put that under the patient, just so when you pull it out, if there's any urine or anything that gets anywhere. These gloves are a hot mess. Oh my goodness. So, where's my syringe? Make sure you have your syringe and alcohol swabs too. So you would come in and whatever you have to put the urine in, you're gonna make sure you drain the bag first. And then come up and, well, the stat lock. Just pretend that I can undo the stat lock because you can't right now. You're gonna hook your syringe in. Pull my bag up here. Lay it down. And then you're gonna make sure you pull a full 10 mLs out. And if you don't, go back in and fill it back up. Because you want to make sure that that balloon is completely deflated before you pull it out. If not, you're really going to hurt the patient. It doesn't look like it's coming out very good. There we go. I got 10 mLs. So I got 10 mLs there. And so I'm going to take that off here. All right, Ms. Jones, I'm just going to pull this out. It's not going to be nearly as uncomfortable as before, okay? All right, and so then you're gonna make sure you check the end of the catheter to see if it's all intact, see if there's any blood or anything abnormal about the catheter. And at that point, you're gonna make sure that you get you're gonna take your gloves off because you might have urine on your hands at this point too. So you're gonna take your gloves off, sanitize your hands. Okay, and don more gloves, but these things are giving me trouble. So you would don more gloves, and then you would take your alcohol swab and go around the stat lock because you want to make sure the adhesive comes off and it doesn't pull the patient's skin and break any skin there. And then you're going to come in, you're going to do any perineal care that you might need to do to wipe them off and make sure they're clean. All right, and I think that is it. Thank you, Ms. Jones.